Assalamualaikum. Today this patient, 11-year-old boy, has been referred to us from the pediatric ward for a scan. He has already been diagnosed with malaria and we are going to do an abdominopelvic scan. Starting from my probe in a transverse position in epigastrium, we can see that over here this is the portosplenic confluence which goes on towards the liver to become the portal vein, and towards the left towards spleen it goes on to become the splenic vein. Anteriorly, just above it, this tissue right here is the pancreas, which is unremarkable. Below umbilicus, this here is the urinary bladder, and behind it we can see the rectum. UB is minimally or partially filled. However, in the sagittal section over here, we can spot some amount of black fluid, where intestines are floating in this black fluid, which means there's trace ascites. Now, as we move on towards the right upper quadrant, we see the liver of this patient, which seems to be slightly larger for his age on appearance and has a slightly altered echo texture. The liver approximately measures 15.5, which for 11 years is larger, so he has hepatomegaly. Right kidney seems normal. Here this portal vein and gallbladder also seem unremarkable. This is another view of the kidney, the gallbladder, and over here we can appreciate the tiny CBD and the portal vein, which are both unremarkable. Now towards the left we can see that the left kidney is normal. However, this large structure over here is the spleen, which on average is as large as the liver, which means this patient has Splenomegaly. Approximately the spleen measures 12 centimeters. This is the splenic hilum. This entire organ is the spleen. Hepatosplenomegaly and ascites are all characteristic of the ongoing malaria. The scan ends here, and this patient is going to require a follow-up scan to see the resolution of the disease.